Hello everybody, this is Dr. Jay. Welcome to another Q&A session with me. Today we're going to be covering topics on dental hygiene and dental cleanings and periodontal maintenance. A question that we commonly get in our practice is, what is periodontal maintenance and why is it important? So I'm going to be touching on those topics, and again, if you have any questions, please comment in the sections below, like this video and share with your friends so that other people can ask similar questions and we can respond to them and hopefully share our knowledge and help improve everybody's dental and oral health. So getting into the topic, what is periodontal maintenance and why is it important? Periodontal maintenance is the dental cleaning visit that happens after you've had a deep cleaning done. Deep cleaning is required when the dental disease, the gum health, has already deteriorated and there's infection and plaque and tartar, as you commonly know it, below the gums, which is why you need a deeper cleaning. Now, after the deeper cleaning, you need a better maintenance schedule than you would normally be seeing, for example, if you did not have any kind of gum disease. So, periodontal disease, gum disease has already set in. You've had your deep cleanings, you've been taken care of, and now you're trying to keep your gums in that healthy state. So, periodontal maintenance is where and how it's done. You're not getting numb like you were for the deep cleanings. You're just getting a better, more intense cleaning than you would compared to what your normal cleaning is. So the difference between a normal cleaning is when your gums are healthy, there's no disease that has already set in, there's no loss of gum tissue or bone tissue or any other infection in your mouth that has caused any kind of degradation of your gum and bone health. A periodontal maintenance is when you've already had some damage happen to your gums, some damage happened to your bone level, they've reduced, your gums are, you've probably seen people, their gums are kind of shrinking, you've heard that old expression, they're kind of a little bit long in the tooth, once the disease is set in, trying to maintain it takes a little bit more of an effort. So that's where periodontal maintenance comes in, because we need to get those root surfaces clean, we need to get the bacteria out and away from the gum, the sulcus where they lie and cause continuing damage. It's kind of like saying if you had any kind of other issues with your body, your general health, like let's say for example you've had a surgery, for example, or you've had any other procedure done and you just need like physical therapy essentially, right? And people need better care. Like for example, if somebody's had their knees done, knees replaced, and now they got to go to physical therapy to get better function out of their knee. There's certain things they can't do, like you're not going to go out and run a marathon right after you have your knee surgeries done, right? You got to take care of that knee, baby it a little bit, and then you're going to go in every 3, 4, 6 months to kind of help recover from that procedure and have ongoing therapy so that you get better use out of your prosthesis with the knee. Same thing with the gum disease. You've had your deep cleanings done, and now you just got to take better care to maintain the level of health you're at right now. And that sometimes means seeing us every 3 or 4 months versus what you normally hear as the textbook 6 months, because the 6 month is a very arbitrary number. It was, somebody came up with that number decades ago based on, hey, 2 cleanings a year is enough. But that's not, everybody's not in the same boat. No 5 fingers are alike. Everybody's health is different. So people who've had gum disease need more care. They need more continuity of care and more maintenance. And periodontal disease is how you're going to get that care to make sure that you continue to keep your teeth for life. You want to brush the ones you keep, kind of, I've heard say that, but also you want to clean the ones you want to keep. So periodontal maintenance, more frequent cleanings, helps you keep your teeth and your gum and oral health for many, many years. Hopefully that helps clarify the ambiguity between the periodontal maintenance and the regular cleanings that we see a lot of you asking questions about. So I'm hoping that clears that up. Moving on to the next question. All right, so here's another one that we get very commonly is, what is periodontal disease? Which is a really good question. Periodontal disease is a disease of the gums, the bone, and the surrounding structure that support the teeth that are in our mouths. A tooth is like, imagine if you have a fence post, and the fence is made up of individual posts that are kind of dug into the ground and they're kind of supporting each other, they're kind of stacked together and they're splinted together, kind of maintaining that fence. Our teeth are very similar to that. The tooth, think of the tooth like a post in the ground, and the ground is the bone and the gums that are supporting that tooth, which is the post per se. If there is any kind of loosening of that ground material, the soil, if there's heavy rains, if there's soft soil and the pole kind of starts to move, it's the one pole initially, and then finally you realize that, wait, they're all connected together. If one post moves, then it eventually drags the other posts with it. Similarly, periodontal disease, if it affects the gums and the bone around one tooth, and if we're not taking care of it, then it kind of spreads around, leads to softening of the bone around that one tooth or the root of the tooth, the gums around that area, and then you'll realize that the bone goes soft and that one tooth starts to move. Eventually the other tooth starts to move. Pretty soon it's like a snowball effect, chain reaction. All the other teeth are starting to get loose. You see people that have their gums are fire engine red. There's some black stains or tartar that's kind of so much around their teeth and the gums. It's literally coming out of the gums. You bleed when you brush. You get halitosis or the odor when you're coming out of your mouth, and you don't feel like you want to be close to somebody because you feel like your odor is enough that even you can feel it. Much less you don't want anybody else feeling it. Bad breath. Chewing is not fun. There's a lot of limitation on foods you can and cannot eat. Also, it leads to general body health problems. So a lot of the inflammation leads to other diseases. So periodontal disease is very obvious. You can tell very clearly, if you're bleeding, you're brushing, if you've got halitosis or bad breath, if you've got loose teeth, painful teeth, you can't chew with certain things, that you might be having periodontal disease. So coming in, having us take a look at it, checking out what's going on with your teeth and your gums is super important, because not only is it important for your smile and your own oral health, but also your general body health. So that should give you an idea of what periodontal disease is, and having yourself checked regularly at the dental practice, getting your cleanings done, and help us catch it early can help us help you in terms of prevention. Because again, remember, an ounce of prevention is worth a pound of cure, and you already heard that. It's kind of cliched, but it's true, and nobody realizes until sometimes it's too late. So hopefully these videos are giving you enough information that you're able to kind of use that and kind of take the right decision for your oral health and for your friends and family as well, and make the right recommendation. So give us a call. We're looking to take care of you, and we're ready to take your phone calls. So thank you. Another question that we get very commonly is, after periodontal maintenance, does the disease go away? What we normally tell patients is our mouths have very, very large numbers of commensal bacteria, or like some of them are good bacteria, some of them are bad bacteria, and there's a natural balance that is being maintained in our oral cavity by that bacteria, where the good is fighting the bad. It's like a war going on in there, kind of, what you mean? And the good overpowers the evil, I guess. So as long as the general health of the mouth is maintained. So as long as you're visiting your dental office and letting your hygienist or your dentist take care of your tooth health, your gum health, getting your cleanings on time, following the recommended regimen for your particular case, then you'll notice that your overall health is maintained. So if you realize that if you're falling sick or if your immunity is down, then sometimes when the body's immunity falls down, then the bad bacteria sometimes will overpower the good ones, and you'll see signs of disease, which is where periodontal maintenance comes in. There's never a point where you can truly say, hey, listen, I'm never going to get sick again. Because if that would be the case, there would not be any need for doctors or the practice of medicine or dentistry. But we help you help yourselves by helping maintain your oral health. So periodontal disease can be corrected by getting the deep cleanings done. Periodontal disease can be kept at bay by making sure that periodontal maintenance is done so that the disease doesn't recur again. Remember, this is a very insidious disease. When people have diabetes or people have high blood pressure, there's no overt symptoms initially. You'll get your blood work done. You'll say, yeah, my sugar's kind of high, and you don't really have like pain because your sugar's a little high, or you don't have any kind of like other symptoms, I hope. If you do, I'm sure, please go see your doctor. If it's dental related, please give us a call. But there's really nobody who's saying, hey, listen, I've got high blood pressure and it's a little high. I'm having some discomfort because my blood pressure is a little high. But eventually, if your blood pressure gets high enough, if your sugar level rises high enough, then you'll start to see symptoms. But a lot of times patients realize damage is already done. And now you're trying to take steps backward and try and reverse the damage, which may or may not always be possible. So again, coming back to that old adage, take care of it in time. Stitch in time saves 9 kind of thing, where again, sounds like cliche, but if we knew what we know now, we could have done things differently, which is why we're hoping these videos educate you that I'm going to take care of the periodontal disease when it's early on, even though it's not bothering you, and then maintain the level of health so that there's no further bone loss. Because remember, the bone is what holds the teeth in your mouth. The gums are what holds the teeth in your mouth and helps maintain their health so that you have a nice smile. Again, remember, the first thing people notice about somebody when they meet is their smile. And if you're not confident about your smile, if you're not confident about, like, hey, listen, do I have halitosis? Do I have bad breath? It's time to take care of yourself. You've always put everybody else first. You put your kids first. You put your family first. There is a time to take care of yourself, and the time is now. You got to take care of yourself, because then only you'll be able to take care of everybody else in the family. So again, does periodontal maintenance completely give you like a guarantee of never getting a deep periodontal disease again? That's, again, like they say, there's no guarantees in life, but as long as you take care of yourself, you can maintain an optimum level of health, which is very important for you. Another question we commonly get is, my parents had bad gum disease, or my parents have lost some teeth. Can this affect me? How is this going to affect me? Which is, again, a very good question. Dental disease can be genetic. If you notice that your parents, one or both, or somebody in your family has had periodontal disease or gum disease in the past, you'll notice that there is a higher chance of people who've had that in their family. They're likely to develop that, and it can be genetic related, it can be DNA related. So if you have a higher incidence of developing this kind of gum or periodontal health, it's kind of more imperative that you kind of follow a more stricter regimen in terms of taking care of your health, taking care of your oral health, coming in for your regular exam cleanings, and making sure that you're following proper home care protocols in terms of brushing, flossing, and water picking, whatever it is that you feel comfortable doing, in order to make sure that you're going in with the knowledge that there is a predisposition towards developing this. So you just got to go the extra mile to kind of, it's like saying, hey, listen, there's a higher chance of me getting diabetes because of my family history, which is why we always ask questions about family history, right? So if you know that there is a certain predisposition towards getting something, then you're just going to want to take extra steps to, like, hey, I'm going to limit my sugar intake. I'm going to take more care of my teeth and my gums, and floss more regularly, and get cleanings on a more frequent schedule, and that's going to be important. So again, that's a great question. So moving on to the next one again. Another question that we also get is, can my mouth affect my overall health? And that is a super, super important question. Oral health is very, very intrinsically related to your general health. The mouth, like I said, it has a lot of bacteria, and if there's any kind of disease, any kind of infection in your mouth, again, that's going into your body, that's going down your throat into your gut, and then it affects other areas of your body, causes inflammation in your body, and can lead to other diseases. So yes, can your mouth affect your overall health? Absolutely, it does. It's been related to heart disease, liver, kidney issues. So please do not discount oral health just because you're not having symptoms. Make sure that you're on top of your regular hygiene and cleaning regimen, and make sure your dental visits are scheduled for the specific prescription that you need, in terms of how frequently you need to come in, whether it be 3, 4, or 6 months. Your hygienist and your dentist at our practice are highly trained and specialized to give you the information you need to take care of you. So give us a call, Bootway Dental, Media Dental, Conshohocken Dental. We're here to take care of you, and we're always looking for new patients. We're happy to help you take care of your oral health, and also for your friends and family. All right, guys, thank you so much for watching. It was great answering all the questions that are commonly brought up. If you have any additional questions that you need more information on, please like this video, put your comments down below about any additional questions you may have. We'd be happy to share information on them on our next Q&A session. Again, can't wait to see you in the practice, and take care of you and your friends and family. Thank you so much. This is Dr. Jay signing off. Take care.